I'm Andy Bucas, co-founder and CEO of Telavita, a Sao Paulo, Brazil-based startup in the healthcare space. Our mission is to democratize access to healthcare with online consultations. Our current focus is on B2B, and we started out in the mental health space with online therapy. However, we're currently in the process of expanding into telemedicine as well. Looking at Brazil, the healthcare sector is struggling with a number of issues, anywhere from lack of qualified professionals due to long wait times, remote areas without healthcare access and high cost inflation. And drilling even deeper, you can see that there's a high cost of mental health and depression associated at the workplace. The World Health Organization has proven that there is a positive return on investment of 4x of treating mental health at the workplace. And there are numerous scientific studies showing that online therapy reduces care costs while increasing adherence and access. In addition to that, the market has been shown and has been demonstrated to be significant within Brazil and across all of Latin America. Telavita is a three-sided managed marketplace. So we basically bring together the patients on the one side and the professionals on the other side, whether it's in the mental health space, in the medicine space, in nutrition. And there's a third party that usually pays for that. Those payers fall into two main categories. The first main category is insurance providers, where we are an alternative to in-person therapy or in-person doctor's visits. And the second side of that are employers. The needs are slightly different. For the one side, we provide lower costs and higher adherence rates and better clinical outcomes. For the other side, we have a much more preventative approach, and that way we're able to reduce absenteeism rates and improve higher productivity rates. How does it work? The process is simple. You open your phone, your app, you choose your professional, you book a session at the time and convenience of your choosing, and you conduct your session in our encrypted online environment. Our business model, we have three different pricing models. Fee for service, we charge a fixed cost per session of 50 minutes. There are different tiers based on the experience of the professional, based on ancillary services we sell in addition to just pure consultations like population mapping, like premium content around education and stimulating a change of behavior. We have a corporate plan which introduces a low fixed fee, resulting in a lower cost per session. And we provide value-based care where we link our remuneration to KPIs of the organization. For example, absenteeism or productivity. And as you can see that in these times of COVID, we've been benefiting from a increase in the number of sessions over the last couple of months. We have three main differentiators. The first one is that our platform is one of the most advanced in the healthcare space in Brazil. We've been investing in it for the last 3 years. The second one is we're not an open marketplace. We are a managed marketplace. We have our dedicated clinical staff. All of those are rigorously selected, trained, and monitored. And this way we can provide a much higher level of, in terms of quality of care. And finally, we are strongly focused on clinical outcomes with dashboards, with real-time data. And this way we're able to have a greater impact on the improvement of health of our patients. This is a selection of our clients across different sectors. We participated in a number of other competitions, acceleration programs. And finally, just summing up the last point here on funding, so far we've raised $1.5 million from a group of experienced international angel investors. We're getting ready for a Series A, but we are also open for discussing a bridge round if that suits. Thank you very much for your attention.
Thanks for presentation. Now, any questions?
What's the penetration of smartphone usage in your key target groups? I suppose many of them are older.
It depends. We attend primarily premium users at this point in time. And I think smartphone penetration is definitely a factor because of that. Currently, 82% of all of our users use smartphones rather than laptops. But that is also because we attend the #1 premium health insurance provider in Brazil, and they attend executive levels of different companies. But at the same time, we also attend companies in factories and in more rural blue-collar job environments. And those people have less smartphones, they have less laptops, so they end up using the corporate workstations that the company set up for them so they can do the online consultations at their workplace.
Okay, thanks.
As you scale this, oh, sorry, go ahead.
No, please go ahead. Please go ahead.
This is Aniko. As your platform scales and you, through the B2B model, put on a lot of clients, how do you deal with the supply side of making sure you have enough qualified practitioners?
We have a dedicated team which is responsible for managing our clinical staff, and our co-founder, Milene Rosenthal, is one of the pioneers in online mental health. She was recognized as Businesswoman of the Year. She's a psychologist. She's responsible for our methodology and for managing our clinical staff. Because of her network and because of her appeal, we have a long list of hundreds and thousands of specialists waiting to enter. However, since we have a closed clinical staff, which goes through a process of selection and training, we don't let more professionals onto our network than we actually need for our customers.
The question I had is related to the payers. You showed that some of your clients are payers.
Yes.
Aren't you becoming a threat to them by building, a set of data about their patients somehow that they probably would like to own?
Yes, I'm sure they would like to own it, but at the moment they don't. And by us providing that data to them, we become a much more attractive supplier to them. The way we position ourselves towards those players is that we are an alternative to a physical clinic. So we're a virtual clinic and we're a scalable clinic. And that allows them to attend patients in any kind of environment and any kind of geographical location. But as a bonus on top of that, we're also providing them with additional data.
And how do you compete against, I guess, hospitals and existing clinics who I'm sure are developing or using or renting platforms and already have doctors and sometimes a brand name?
That is an important factor. Some of them have become partners of ours as they put their clinical staff onto our platform to monetize free capacity. However, we don't really see them as a big competitor because physical treatment, physical consultations will never go away for certain types of treatment. However, we can act as a funnel for them and we can actually direct patients to them for the physical follow-up exams.
Thank you.
So can you do prescriptions without seeing the patient?
The legislation in Brazil for online prescriptions was just passed due to the coronavirus crisis. And we're in the process of integrating with 2 other startups that do the online prescriptions.
Thanks. So time is up. And